Good morning. We'll go ahead and get started. For those of you who don't know me, I am Brian Lewis. I'm the Trowbridge Endowed Primary Care Chief Resident this year. Unfortunately, Dr. Trowbridge couldn't be here today, so she asked me to step in, and I now have the distinct honor of introducing our Medicine Grand Rounds speaker, Dr. Richard Keller, this morning. Dr. Keller started his career at Connecticut College. He then went on to get a bachelor's and master's in history from the University of Colorado Boulder. He then went and completed his PhD at Rutgers University in history as well. He followed this up with a postdoc fellowship at Washington University in St. Louis. Afterwards, we were fortunate enough to recruit him here at UW, where he currently holds the title of Professor in History and Medical History in the Department of History and Bioethics. He also holds the title of Associate Dean in our International Division. Dr. Keller has authored 5 books, 9 book chapters, countless journal articles, and numerous book reviews. He has been the invited guest lecturer at places across the country as well as internationally. He also has been awarded several grants and honors throughout his career. Notably, he was given the National Science Foundation Science and Society Scholars Award, and he was also given the Department of Education Title VI National Resource Center Award in Global Studies. Over his career, he has supervised numerous graduate students and mentored them during their dissertation, and he has served on countless committees here at UW, including chairing the Global Health Institute Review Committee, as well as our School of Medicine and Public Health Faculty Advisory Committee. Please join me in welcoming Dr. Richard Keller, who will be giving us a talk today on climate change and health risk, learning from recent extreme heat crises.
I'd like to thank Dr. Lewis for his extremely generous introduction, as well as to thank Dr. Page, who I'm sorry is not here today, for the kind invitation to come address you folks. I actually gave a similar talk where Dr. Page was in the audience at the Town and Gown Society last spring, so I guess it worked out if he invited me to come speak to you folks. We'll see. I should also say I'm honored that the father of one of my current graduate students, Dr. Lucy, is here today. So we'll see how this goes. Does everyone have what they need from this slide? Anybody, I should say, does anybody still need this slide? Okay, great. I'm going to go ahead and move forward. I want to begin with a couple of updates to this talk that I've completed in the last couple of weeks. And I'll begin by talking about a certain tweeter-in-chief and the tweets that shall not be named concerning natural disasters and mortality. As the author of a study commissioned by the French Ministry of Health on mortality reporting in periods of natural disaster, I took particular offense at a barrage of tweets that came out just about 2 weeks ago now, perhaps I think it was 2 weeks ago yesterday, about mortality during Hurricane Maria in Puerto Rico. As I'm sure you all know, there were 2 studies, one from Harvard, one from George Washington University, that billed mortality on the island of Puerto Rico at about 3,000 deaths linked to the disastrous hurricanes last fall. Our president denied this figure, and he argued that many of these deaths were probably due to old age, that there were really just a dozen or so deaths that could be directly tied to the hurricane, that instead the Puerto Rican government was simply lumping in every death that happened from old age into the mortality figures, and that this was a vast democratic conspiracy. As I argue in an op-ed that just came out in Scientific American on Monday, I believe, maybe it was Tuesday, this, I would emphatically argue, is not the case. And I want to draw on the heat disaster of 2003 in Paris in particular, about which I wrote a book that came out a couple of years ago, to point out that Pedro, who was 72 years old and died in this building in the Avenue de l'Observatoire, did not die of old age. Nor did Robert, who died in this building in the Rue de l'Isly, in the 8th arrondissement, nor did Paulette, who was 80 years old and died in this building, very close to the Arc de Triomphe. Even Sonia, who was 89 years old and died in this building in the 16th arrondissement in the Avenue Bugeaud, did not die of old age. Nor did Robert, who was only 48 and died in this building. Nor did Françoise, who was 43 and died in this squat that was occupied by homeless injecting drug users. All of these folks and a handful of others died in August 2003, and they did not die from old age. Instead, they died from extreme heat. And as our government is currently doing with the crisis in Puerto Rico, the French government initially denied that these deaths were anything but natural. So how did these people die? Well, they died. Their deaths are closely related, I should say, to an absolutely devastating heat wave that struck Europe in the summer of 2003. There were actually 3 heat waves that summer, one in June, one in July, and one in August. And each one of these brought with it elevated levels of mortality, and current estimates indicate that about 70,000 excess deaths can be attributed to extreme heat across the continent that summer. That's a figure for the entire summer. In August alone, in the first 3 weeks, eventually the French, it's called ANSERM, which is essentially the French equivalent of NIH. It's not a direct parallel, but it's somewhat similar. Estimated about 15,000 excess deaths in just 3 weeks that they attributed to extreme heat. And in Paris, there were just north of 1,000 deaths that could be attributed to extreme heat, again in that same period, the first 3 weeks of August. This is a plot that shows daily high temperatures is the sort of bendy line on top. The dotted line on the bottom is our daily low temperatures. And here you have a daily plot of excess deaths, okay, where you can see that just as the heat begins to rise, a couple of days behind, there's a slight lag, mortality begins to increase really dramatically, peaking on August 12th with about 2,200 excess deaths that we can attribute to extreme heat. In a 2015 study, I explored the question of social vulnerability to extreme heat. What was it that basically targeted some people with death and allowed other people to live? What were the sorts of factors that exacerbated vulnerability for some and might have enhanced resilience for others? In the course of about 13 months of ethnographic fieldwork, I spent this time in the city reviewing media and interviewing neighbors, relatives, and neighborhood shopkeepers and so on in the vicinity where a number of people died. And what I discovered was that there were critical disparities in who died and how. Those disparities included sex, age, location, and socioeconomic status. Women were likelier to die than men. The elderly were far likelier to die than those who were middle-aged or younger. People who lived in cities tended to die in much higher numbers than people who lived in suburban developments or in rural areas. And people who were poor tended to die in far greater numbers than people who were middle class or upper middle class or even rich. What's critical is that none of these factors alone explains elevated mortality. There were plenty of women who proved quite resilient. There were plenty of elderly who survived the heat wave just fine. Plenty of people who lived in cities and plenty of people whom we would consider poor. It's when you start to combine these factors that you begin to see really significant exacerbation of vulnerability. So someone who is elderly and a woman and lives in a city and is what we might consider poor would have been far less likely to survive than somebody who was the opposite of all those things. I would argue that this accumulation of risk factors points to the social rather than the natural basis of the disaster. That is that when we start to look at the combination of these different kinds of social factors and demographic factors, then we begin to see where the real elevation of risk is. And this has to do with demographic trends, it has to do with social trends, and it has far less to do with simply extreme temperatures. I want to begin by looking at age and sex disparities. I'm sorry that this is a graph that's in French, but I can do a very quick translation. Women, the green line on the bottom is women who are under 44, or 44 or under, I should say. The blue line in the middle is women who are 45 to 75, and the red line is women who are 75 and older. As you can see, mortality is dramatically elevated for elderly women. Okay, women who are north of 75 years old are far, far likelier to die in this period than those whom we would consider middle-aged or even entering early old age, and certainly women who are young. For men, we see a similar trend, but it's significantly less elevated for the elderly category. And so what I want to do for the next couple of minutes is to try to explore what were the kinds of factors that targeted the elderly in particular. What are the sorts of things that put them at extreme risk? As I think everyone in this room probably knows far better than I, there is a physiological basis for why the elderly are at much higher risk for dying during heat waves than those who are middle-aged or younger. And that includes poor thermoregulation. That is, as we get older, our bodies dissipate heat far less effectively than they do when we're younger. Signal processing also begins to break down as people enter advanced old age. So messages of dehydration don't get to the brain quickly enough to translate into thirst. And you can see that there are sort of two categories of patients to whom these sorts of things apply. The highest risk groups are those who are over 75 years old, who begin to experience these kinds of physiological effects, as well as patients who are taking neuroleptics for various psychotic disorders, or people who are taking anti-Parkinsonian drugs, and both of those classes of drugs produce similar effects, right? They minimize thermoregulation, and they basically mask those messages of dehydration. That said, I'm kind of unsatisfied with the purely physiological explanations for elevated mortality in these groups. And so I'd like to begin to explore a handful of social explanations. One of those includes the social and political marginalization of the elderly since the early 20th century. Basically, beginning around the turn of the 20th century, we begin to see the emergence of a powerful political discourse decrying the changing nature of the demographic and age structure of the French population. We begin to see arguments about sort of fears and anxieties about the aging of the population and about the increasing feminization of the population. To the extent that in 1948, one demographer, a demographer writing a national report commissioned by the government, actually blamed the occupation of France by the Germans on the preponderance of elderly women in the country. That France was quite simply too feminine to ward off the German invasion and too weak because of its old age. That it was not a young and vital nation. Instead, it was an old, decrepit, and increasingly feminized nation. Another reason that I want to argue that there's got to be something social rather than something purely physiological going on is that there's another population that's also extremely physiologically vulnerable to dehydration and that poorly thermoregulates, and that's newborn babies, right? Newborn babies. So if we look at various data that indicate how many elderly excess deaths we can attribute to the heat wave, more than half, indeed, 4/5, 12,000 of those 15,000 excess deaths happened among people who were 75 and older. How many newborns do you think died in August of 2003? How many children under the age of 1? Anybody want to hazard a guess? How many thinks 100? Okay, there's a hand. 50? Okay. 6. 6 babies. Okay, six excess deaths among newborns that you can attribute to, that possibly attribute to heat. This could have been a bad flu or some kind of an infection that swept through a maternity ward. It's a statistical irregularity. But indeed, there were very, very few babies who died compared to staggering numbers of elderly who died. And I would argue the reason for that is that babies are, by definition, embedded in social networks. A baby cannot live in isolation. Right? A baby is either in its parents' care, in the care of a guardian, is in medical care, or is in the care of an orphanage. Otherwise, newborns quite simply die. They cannot live in isolation. We have, I think, a mistaken notion that many of our elderly relatives can live in isolation. And I think the heat wave bore out that that's really not quite the case. So where social networks were extremely protective for newborn babies, they were largely absent for the very elderly. And we can link some of those disparities if we look at a handful of data. These data are from a couple of years after the heat wave, but they indicate a really curious phenomenon that's going on, in particular in Paris. Right? So this brings together age, sex, and geographic location. If you look at men who are 65 and older, about 70% of them are married. Women who are 65 and older, only about a third of them are married. If we shoot up to 80 years of age and older, 2/3 of men are still married. But women, 80 and older, only about a fifth of them are married. So I know that marriage is not a perfect correlate for living with someone else. There are certainly married couples who live separately, and there are couples who are unmarried who live together. That said, it's about as good as we can get, right? About as good an indication that we can get of what of what's kind of going on here. Elderly men tend to live with someone else. Elderly women do not, right? Elderly women do not. Part of this has to do with a demographic shortage of men once you get to a certain age, right? Women live longer than men in France, just like they do in the United States. Part of it has to do with the effects of the First World War and the extreme demographic toll taken, the extreme mortality toll taken by men of marriageable age in the early 20th century, where many of them were either so physically disabled as to be unable to marry, or were simply killed during the war. So you've got sort of a surfeit of women from the early 20th century, and not nearly enough men to produce a kind of marriage parity that you might expect. What this means is that there are far more women living in isolation than men, living alone than men. And indeed, those women tend to be a little bit poorer than men as well. Elderly women, 75 and older, there are about 12.5% of them live in poverty, where only 8.5% of elderly men live in poverty. So what you see is a kind of intersection here of age, sex, social isolation, urban settings, and poverty. This is really, I don't know I know 3 is a hat trick, but this is sort of adding 1 to that, right? Adding an additional risk factor. I want to turn to geographic disparities for a moment and try to explore what's going on there as well. I don't expect you to absorb these figures at all. I just want to point to a couple. This is basically a geographic distribution of excess deaths. And actually, I can talk about what constitutes an excess death in the discussion. I don't want to get into that technicality right now. But essentially, here's the column, the critical column of excess deaths, okay? And what you'll see is that there are a few hundred here and there, but there's a major concentration of about 5,000 excess deaths, and that's in the Ile-de-France. Anybody know what the Ile-de-France is? I'm sure it's Paris, right? Paris and peri-urban Paris. It's essentially the Paris and its surrounding suburbs, which actually don't look like what we consider suburbs in the United States. They tend to be paved, concrete, asphalt, high-rise, all of those sorts of characteristics that we would consider perhaps more characteristic of, say, the outer boroughs of New York than we would consider suburbs like, say, Evanston, Illinois, or something along those lines. In any event, so you might attribute this to population. We know, of course, Paris has a significant population density. Indeed, it's half the size of Madison in terms of its square mileage. But where Madison has about 250,000 or so, Paris itself, just that city, that 40 square miles, has about 2.5 million or so. So about 10 times the population in about half the space. So that density is certainly an issue, and population concentration is an issue. Maybe that accounts for this. Well, actually, in the city of Paris itself, with about 1,000 deaths, we see that that's about 7% of excess mortality, but Paris only has about 3% of the French population, so this is disproportionate. Likewise, the Ile-de-France bears about a third of the death toll, about 5,000 of 15,000 excess deaths, and it contains only about 18% of the national population. So in both cases, you're looking at virtually a doubling, if not more, of the excess death burden that it goes beyond population. So what's going on? Why are people dying in cities more than they're dying in rural or suburban environments? Well, some would argue that this has to do with the urban heat island effect. That is, any of us who've been in Chicago or New York on a hot summer day know well that the city is quite simply hotter than those surrounding green spaces. And if you walk into Millennium Park or Central Park on a hot summer day, you can almost feel that temperature drop by a couple of degrees as soon as you step off the asphalt and into that green space. So I don't want to argue that that's not a factor. That's absolutely a critical factor that might be shaping excess mortality in cities. And indeed, the data bear this out. This is a photograph that I took. I was standing on the Pont Mirabeau, which straddles the Seine River, between the 16th and 15th arrondissement. I'm facing the 15th here. I included the Eiffel Tower just to prove that that's where I was. No denying it. In any event, the 15th here, you can see this is sort of a textbook example of an urban heat island. You've got these tall, high-rise buildings that are poorly ventilated. You have lots of concrete, asphalt, steel, and glass. These are either reflective or absorptive structures that either reflect heat where it will be absorbed somewhere else, or quite simply retain heat all day and all night. And the 15th was the site of the highest excess mortality in Paris in that summer. Directly across the river, in the 16th, this is a much more typical Parisian cityscape, lack of an Eiffel Tower notwithstanding. This is one of the wealthiest neighborhoods in the city, and it also conforms to perhaps our idea of what Paris looks like. That sort of 6-, 7-story 19th century Haussmannian construction. You'll notice that most of these buildings are actually quite well shaded by trees, so you can imagine the temperature might simply have been lower here. And indeed, this neighborhood experienced the lowest excess mortality during the disaster. But as I discovered in the course of my fieldwork, that's not a perfect explanation. That doesn't really get us all of the way to understanding why mortality was elevated in one neighborhood and not in another. I focused on a subset of the population that died in Paris during the heat wave. I focused on what the media had quickly labeled the forgotten or abandoned deaths of the heat wave. And those were those who were buried at public expense. Those were people whose bodies were never claimed by relatives or friends, who basically died alone because they had lived alone. These were people who had not necessarily taken care of their own funeral expenses in advance of dying. They tended to be much poorer than the population in general. And there were 100 of them. So 1 in 10 deaths that took place during the heat wave in France happened among someone who lived in near complete social isolation and who lived in poverty. And there was a curious phenomenon that I discovered in the course of my work. It has to do with 19th century urban planning. I am a historian. I'm sorry, I can't escape that completely. It has to do with tendencies of 19th century urban planning, where the structure of the city began to change in the remaking of the city. For any of you who've been to Paris, Paris is a 19th century city. It's a city that has, unlike many other European capitals or other European large cities, doesn't really have those medieval neighborhoods like you might see in a place like Edinburgh or even in southern French cities like Aix-en-Provence. You quite simply don't see those kinds of neighborhoods because the city was nearly entirely bulldozed in the course of the 19th century and completely rebuilt. It was rebuilt with a particular class structure in mind. New buildings in the course of the 19th century tended to concentrate the wealthy on lower floors, and they concentrated the poor on upper stories of buildings. And so you can see in this diagram, here's a ground floor, which would include a retail space usually, or possibly a pub or a cafe, something along those lines. When you go up to the first floor, you'll see that this is really, sorry about the quality of the reproduction here, but it's a pretty sumptuous bourgeois spread. You see a man and a woman relaxing, they're at leisure, there's a marble fireplace, there's a crystal chandelier, there are sumptuous draperies. When you go up another story, the space becomes a little simpler. There's certainly, we're certainly talking about at least a middle-class family living in this environment, but it's, not quite as nicely furnished as the one below. So as you go up the staircase, you go down slightly in socioeconomic status. As you get to the third floor, here you can see a man and a woman in a pretty Spartan apartment who are showing their dog an empty bowl. They're unable to feed their dog because they have so few resources. And in the apartment next door, notice that one apartment is now split into two, so you're halving the square footage. Here is a landlord handing a tenant a notice of eviction, and notice all of his furniture is already gone. When you get up to the attics, here's where you begin to get into really desperate poverty. This is where an extra, basically a bit of extra rentable space right under the roof emerged in the course of a new kind of building style that emerges in the 19th century, mid-19th century. Here you have a desperately poor family. Here you have that very stereotypical starving artist living in a garret. I think that this image may be where that stereotype comes from. And in the middle, you see someone lying sick in bed, probably with tuberculosis, and you can see that the roof is actually leaking on this person in their bed. So what I'm trying to get at with this kind of belabored dissection of this slide of this cross-section, is that you can see that as you go up vertically, you go down in socioeconomic scale. This has everything to do with increased vulnerability of the elderly poor, in particular, who live in Paris during the heat wave. Why? What are the sorts of factors that are at play here? Well, one, as we all know, if you go into your attic on a hot summer day, the heat load rises, right? That's pretty basic stuff. So quite simply, those upper stories are quite a bit hotter than stories below. And that just has to do with thermodynamics, right? At the same time, it's not just that heat rises, but indeed, as you can see in this image that I took from Robert's window, one of the first deaths that I investigated, the rooftops of Paris tend to be covered in zinc, which tend to reflect heat. So heat is radiating from these roofs into the apartments that you can see here. If you look out his window, you can see this zinc just about everywhere, kind of reflecting heat directly into the apartment. That apartment has one window. There is no possibility for cross-ventilation. It's very small. It's about 90 square feet or so. So these are tiny, closet-sized spaces, most of which have no running water in contravention to building codes. So there's no bathtub. There's no possibility of cooling off by filling a tub with water. It's even difficult to get a drink of water without having to go down the hallway, sometimes to another floor, to a water source. The rooftops of Paris are charming to look at. There are many calendars that you can buy, or coffee table books that show photographs of these, very, very charming 19th century buildings that are very much a part of the cityscape. But I can also say that these are absolutely miserable spaces in which to live. In the course of my fieldwork, I discovered that many of those who died in the course of the heat wave, many of those who were socially isolated, many of those who were buried at public expense, lived in marginal spaces like these, including Pedro, the very first slide I showed, lived in a luxurious building, but he lived in former servants' quarters in that building. This is his hallway. You'll notice that the floor is unfinished. The place was teeming with pigeons and mice when I visited, and you can see exposed wires in the ceiling. Someone like Paulette, one of the other earlier slides I showed, was an 80-year-old woman who lived at the top of this spiral staircase. She had to descend this spiral staircase every day to access water from this source. Robert, another one of those whose apartment I visited, lived at the top of this staircase. Robert was younger. He was about 56 years old, if I remember correctly, but he was also morbidly obese. He was basically a shut-in who had no access to an elevator, and therefore, one of the things we have to recognize is that we're talking about populations who are essentially trapped in these apartments by their staircases. Right? By virtue of living in poverty, by virtue of living in old age and poverty, or in disability and poverty, they are trapped into these extremely hot spaces, where even overnight, where the overnight low might be 75 degrees on the street, those buildings are retaining heat, and it's well over 100 degrees Fahrenheit inside those apartments. So there's a series of factors, right, that are combining to put people at increased risk. Now, many would argue that, quite simply, demographic change, that is, we're seeing populations age in industrialized countries, that an aging population combined with climate change, combined with a warming climate, is putting people at increased risk. And I would argue that that's absolutely the case. And indeed, there was a paper that came out in Science, it might have been Nature, I often get Science and Nature confused, that it pointed out in 2004 that indeed these kinds of heat waves will increase in frequency, duration, and intensity as the planet warms. To that end, I want to take a look at a couple of other sites where we've seen increased heat mortality in more recent years. Right? The Paris heat wave happened 15 years ago, and indeed it was in this week, it was, I believe, September 23rd, 2003, that the initial report of 15,000 excess deaths came out. But now, much more recently, just this past summer, devastating heat waves struck Tokyo in particular, with a record number of 70,000 people who were taken to hospitals, and several hundred deaths attributed to heat in Tokyo. What's going on in Tokyo that might parallel what's happening in France? Well, we're also seeing an aging generation. We're seeing, an aging population, and an entire generation of extremely socially isolated elderly who are living in cities like Tokyo and Osaka and Kyoto. And there was an extremely wrenching piece that came out in November 2017 in the New York Times that I would recommend to all of you if you're interested in what's happening to an elderly population in Japan. There's also a concentration of elderly in Arizona, in the American Southwest, in Phoenix in particular. They are actually not the ones who are dying from extreme heat in Phoenix, however. Many elderly who are, of course, at extreme physiological risk for dying during heat waves also tend to live in air-conditioned spaces in the Southwest. But what's happening is that there are increasing numbers of poor, largely undocumented migrants who are living in places like Phoenix, who basically constitute the labor market, the entire service industry that helps to support these vast numbers of retirees who are migrating to places with relatively little infrastructure. And what's happening there is we're seeing that increase of undocumented migrant populations who are increasingly dying from extreme heat. One of the things that's curious about elevated heat mortality in a place like Phoenix is that the hot places are not typically places where you see significant heat mortality. People who live in hot climates tend to know how to live in hot climates. They tend to be, if not physiologically adapted to it, at least socially adapted to the heat. And so extreme heat tends to kill people in northern climates, in cooler climates, in places like Chicago, in places like Paris, in places like Moscow, all places that have seen devastating heat waves in the past 20 or 25 years. What's happening here is something different, a different kind of population that is at risk and that's increasing in size. And that is that population of an equally marginalized population to what we're seeing in Japan or what we're seeing in France, but a population that looks considerably different and yet is no less at risk. And that's a laboring population, people who are working outside in extreme temperatures, who are some of the real sentinel cases in any extreme heat wave. They tend to be the first ones who are admitted to hospitals because they tend to collapse in public spaces. Right? Asphalt workers, roofing workers, people who are working in extreme heat, who collapse on the job, and they collapse in a social environment, right? A work environment where someone can bring them to a hospital. But they're usually an indication of increased mortality to come. A similar phenomenon is also happening in another hot climate in South Asia, in Pakistan in particular, but also in northern India, where increased, really dramatically increasing extreme heat waves are killing people in significant numbers, in something that really hasn't been experienced before. Here, there's something else going on. Yes, outdoor labor is a critical factor, but indeed, there's another phenomenon that's happening, which is urbanization. The dramatic explosion in the sizes of some of these cities and the occupation of extremely marginal housing, extremely precarious housing, is something that's putting populations at extreme risk. So what's happening is that, on the one hand, the climate is changing. And we are seeing increased duration, frequency, and intensity of heat waves. At the same time, we're also seeing an increase in certain populations at risk. As the social safety net begins to fray in places like Western Europe, as we see increased economic inequality in places like the American Southwest, and as we see increased urbanization in places like South Asia, what we're seeing essentially is an increase of populations at risk, right? Increased sizes of vulnerable populations. And that's, I think, a phenomenon that we have to watch very carefully here in the United States, just as we have to watch around the world. I'm often accused of being a real downer. The courses that I teach, the talks that I give, I tend to work on really, really depressing material. I think that's kind of universal in people who study the history of medicine and public health. There are some really important triumphs, but there's a lot of really grisly material as well. So I want to end on maybe not a happy note, but a note of optimism. This is a cafe that was in the ground floor of the building where I lived when I did my longest stretch of fieldwork. I was in Paris on a grant from the city of Paris. I encourage you all to get one if you can. They are fantastic. They bring you there for a year and give you a little bit of money and help you with your visa and all that. And as I always tell my graduate students, you should always pick a topic based on 3 factors: location, location, and location. In any event, this is a cafe where I would go have coffee every morning before I went out to do my field work. I say field work, right, as if it's this extreme hardship post. I got to live in Paris and really enjoy a fantastic city while studying, admittedly, some really disturbing material. I would go in this cafe every morning, have a coffee, and one of the things I noticed was an elderly man who lived down the street. I had recognized him. I would see him around the neighborhood all the time. And he walked in with his dog. He was probably in his early to mid-70s, so not extremely elderly, but certainly at the age of risk. He wasn't terribly rich, at least if we can judge by the clothes that he was wearing. I know we shouldn't judge a book by its cover, but he didn't strike me as being particularly well off. So here we have an elderly man living in Paris. He's older. He's not particularly rich. He's somebody who would be at risk for dying during the heat wave. But there were 2 factors, I think, that made him a bit more resilient. One, he had a dog. If you have a dog, you have to leave the house at least 3 times a day. This is basic biology, right? And what that does is it gets you out of the apartment and onto the street. It gets you into a cooler environment. The street was plenty hot, but it was still, I guarantee, cooler than his unair-conditioned apartment. The other thing is, and this is, of course, purely anecdotal, so I can't extrapolate from this and say anything more than what I witnessed. But on a number of those mornings when he would come into the cafe, he would hand something to the bartender, and then he would bend backward over the bar, and the bartender would put eye drops in his eyes. I'm not sure what kind of medication that was. Maybe it was for glaucoma treatment. Maybe he quite simply had dry eyes. I'm not positive. But this was someone who, and I can understand, some people have a hard time putting drops in their own eyes. My wife can't do it, absolutely cannot. So I understand that. But here is someone who is embedded in a social network. He goes to this cafe. He gets his medicine, right? And he has assistance in taking that medicine from someone younger than he is, right? But from someone who will also know if he doesn't come in the cafe. If he doesn't come in the cafe, someone is a lot likelier to go looking for him and is a lot likelier to find him when he's merely suffering from heat exhaustion before it gets to the point of heat stroke. So a somewhat heartwarming ending to a really dismal set of stories, but one that I think indicates a possible pathway toward resilience, one that indicates that perhaps patterns of sociability, making our cities walkable, making our cities conducive to sociability, can go quite a long way toward minimizing risk for at least some of those populations. With that, I want to thank everyone who sponsored the research, as well as you folks here in the Department of Medicine. Thank you.
All right, we'll now take questions.
Dr. Lucy. Sure. So just to repeat the question for those who might not have heard it, Dr. Lucy asked about that French tradition of the Auguste Holiday, where everyone goes on vacation. The first Saturday in August, there's this massive migration out of French cities toward the beaches, toward the mountains, toward the forests. And that's, of course, typically more mobile people who tend to leave the city and might tend to leave elderly and possibly disabled relatives behind. And that was very much a story in the French media, and it was very much a part of the politicization of this catastrophe in the immediate aftermath of the heat wave. I would argue that it is a factor. It's not the factor it was made out to be in the media. This was a very easy story for politicians, in particular politicians on the center-right, who were in power at the time, to decry a tradition of French entitlements, to decry a tradition of what they argued was essentially a decline in family values and a sort of tradition of entitlement and vacationing. So the story was essentially you've got young, happy, middle-class families who are basically going off, selfishly enjoying their paid vacations, paid for by the government, paid for in an unsustainable way, while they leave their elderly relatives behind to die deaths that a simple phone call might have prevented. It was a very convenient political story for a government that was trying to ratchet back some of those benefits at precisely that time. I think it is part of the story, and I'm sure a handful of deaths are certainly attributable to that kind of negligence on behalf of families. I think many more were probably inadvertent abandonment. But indeed, as this set of stories of this socially isolated population begins to bear out, most of those who died had no relations. Okay? Not just this 10% who were buried at public expense, but there were many people who died in nursing homes. There were many people who died in their own apartments who quite simply didn't have relatives. They took care of themselves. They were in a place financially where they had arranged for their own funerals and so on, so they weren't buried at public expense. But indeed, that's the majority of the population, are people who quite simply didn't have these kinds of connections. But it is a great question and certainly part of the story. Yes?
What you said all makes sense, but my training in other cultures in Europe and particularly in Asia, that the younger people do take care of their older relatives. They have a lot of respect and the care for them. How does that fit into this?
Sure. So the question was about, in many other cultures, the elderly aren't quite so isolated. At least there's a stronger tradition of younger generations taking care of their elderly relatives. That's certainly the case in much of East Asia, to be sure. It's increasingly not the case in Northern Europe in particular. In Southern Europe, there might be a stronger tradition in, say, Italy and Spain, but they experience significantly elevated mortality as well. Part of it, I think, has to do with patterns of sociability in certain cities. Paris had staggering excess mortality in 2003. Marseille, another densely populated city with high crime rates, with extreme economic inequality, suffered a very low elevated mortality rate. I would argue that part of this has to do with Marseille experiencing a devastating heat wave in the early 1980s, where the city had a municipal alert system in place, so this might have raised awareness. But also, my experience of living in both Paris and Marseille, and I love Paris and I love Parisians, don't get me wrong, Marseille is just a much friendlier place. It's a place where your neighbors will invite you in for a drink, whereas you're lucky to get to know your neighbor's first name after living next door to each other for a year in a city like Paris. So I think that there are places where there are forms of sociability that provide for much greater resilience in all kinds of disasters, not just extreme heat, and places where the fraying of those social networks is increasingly putting people at risk. Thank you for the question. Yes?
Thank you for a wonderful talk. Something you said at the beginning, though, that I wanted to query. Having studied thermal regulation for many years, I'm not aware of any data suggesting it's different in the elderly. I agree that when you say that heat stroke, the elderly are at much higher risk for morbidity and mortality. The thermal regulation in the elderly isn't any different from the young, as far as I know.
You would certainly know far better than I. I'm guessing that you're a physician if you're in this audience. And so this is, I've done quite a bit of reading on this. I actually had a long conversation with Phil Farrell, the former dean of the School of Medicine, about this. He's the one who suggested I actually do the project. So sometimes deans do have good ideas. It's important to point out. But this was certainly part of the conversation that I had with Phil and that I've talked to with a number of other physicians. So honestly, I'll defer to you on this one. But yeah.
Half of it is radiant heat exchange, the exchange of heat from the skin to the surface. That doesn't change. Evaporative heat loss is a compensatory mechanism. That doesn't change. In fact, if you really understand thermal regulation, the elderly might be at a little less risk.
Okay.
When you have heat stroke, part of that is when you hit temperatures of heat stroke, which is 41.8 degrees centigrade, in general, your basal metabolic rate doubles. And in the elderly, that increase in the basal metabolic rate is actually a little bit less. So
Okay.
from a physiological standpoint, the elderly might have a slight advantage. So now, on the other hand, with dehydration and when your temperature goes up about 41 degrees, heart rate doubles. If you're older, you're going to be at high risk. But specifically in terms of thermal regulation, there's no difference.
Okay, well, thank you for the correction, and I very much appreciate this. Actually, it sort of helps my argument, though, that in the absence of increased physiological risk, then one would argue that indeed it must be social factors that are perhaps exacerbating the death toll among the elderly. So thanks for that point, and I need to go back to the literature, clearly, but thank you. There was a question here, I think. Sure, disability was a critical factor, and so that includes mental disability as well. So the populations that were at the greatest risk were, as I indicated earlier, those 75 and older. That's really the bulk of the population. But if you start to dissect younger populations who were at risk, then you see mental illness begin to emerge as a real risk factor. And I'm including addiction in mental illness there. So part of this, again, might have to do with the physiological effects of alcohol further dehydrating people. There were many cases of younger victims of heat stroke whose stories I was able to assemble in the course of my field work. There was a story of a guy who lived in one of these apartments up in the attics of a building. He did get out of the house, but he got out of the house pretty much exclusively to go to a bar. And he drank really nothing but beer. That was what he consumed. He never drank water, never drank coffee. He merely drank. He was probably drinking himself to death already, but certainly the heat didn't do him any favors in this circumstance. So there were a number of cases where I found this to be precisely the case. The case of Françoise, the woman who lived in a homeless woman who lived in the squat and basically consumed alcohol and heroin. One would argue that she probably was not in the best position for any kind of resilience in the face of that sort of heat as well. So yes, especially when you start looking at younger populations. Now, the impact of dementia, I have to imagine, is a sort of confounding factor that, I guess another exacerbating factor in the elderly. That's something that didn't emerge as clearly in the course of my work as was the really sort of stark case of mental illness in younger populations who are at risk. But yeah, absolutely, it's a critical factor. Homelessness was less of a risk than you might think, actually. Only a couple of, out of the 100 or so, forgotten or abandoned victims whose stories I reassembled, only 4 were homeless. So perhaps less of a story than you might suspect. Yes, sir. Yeah, so the question is basically about what kinds of measures has either the state or other institutions taken to try to minimize this sort of risk. Have there been policy changes that have been put into place? Yes, there have, some more effective than others. So in 2004, the French National Assembly passed a law indicating that all retirement homes needed to have at least one air-conditioned room. And as I'm sure you all know, just a little bit of respite from the heat is about all we really need. A couple of hours in an air-conditioned room is enough to not necessarily make a heat wave less miserable, but certainly enough to make it less fatal. So that's one change. Other changes have been perhaps a little bit less effective. For example, the city of Paris set up a telephone network where if you perceive yourself to be at risk of dying during a heat wave, you're welcomed to register with a sort of city-sponsored social network where once the temperature gets above about 85 Fahrenheit, so once you begin to get into risky extreme heat, the city will call you twice a day. A social worker will call you twice a day just to make sure that you're doing okay. There are a couple of problems with that. Many people unregister from the network because they're getting bothered and they simply don't want the phone calls when they don't really anticipate there's all that much risk. Another real problem is that in the first few years of this program, only a few thousand people registered with the system. And this is in a city of 2 million people and an aging city where you'd imagine there are hundreds of thousands perhaps of people who are at risk. The problem is that nobody wants to identify as being at risk for dying during a heat wave, because to identify in that sense you're saying, well, I conform to this image of being old and poor and at risk, right? Old and poor and vulnerable. That's a place where none of us wants to imagine ourselves, right? I know now that I'm in my late 20s, I don't like to think of myself as getting any older. And when I take my atorvastatin every night, I resent it, right? Because I feel like I'm staring mortality in the face, right? And so I can't imagine myself possibly picturing myself as vulnerable to death from extreme heat. Other sort of longer-term solutions. One of the biggest changes is that after 2003, a Green Party begins to emerge in France. There was a Green Party before. It was not really primarily concerned with environmental issues, somewhat counterintuitively. It was concerned with issues around immigration, issues around sustainable farming practices, and a sort of rejection of GMOs and that sort of thing. So it was very much rooted in a kind of French culture of traditional agriculture. After 2003, climate change really becomes central to the agenda, not just of a Green Party, which begins to move rapidly in the direction of looking at environmental sustainability, but it becomes a mainstream political concern on both the left and right in France. So with the exception of the extreme right, the National Front, virtually all French political parties are grappling with climate change as a central issue on their platform. And so you see now there are restrictions of traffic in Paris and other major French cities, increasing incentives for people to move toward hybrid or electric cars. There's a real effort to try to control pollution. Ozone pollution was another critical factor, right, that put people at extreme risk during the heat wave. So there are some steps being taken in that direction as well. Thank you. Yes? Wow.
And so interesting to see this kind of microcosm of how the resilience of the residents and how important what social networks they had in place in terms of their ability to cope with this very traumatic event. We had 2 hours, we had 2 hours notice to evacuate on August 23rd, and we just got back on Saturday. So it was, and me wanting to help and all of that, I learned a lot about some of these individual residents whom I had never even encountered before the event. Having a companion was pretty critical in problem solving and being able to make arrangements with family.
Sure.
So many of these residents did not have any family members. These were elderly folks, many of them disabled. It was really striking. One woman died during the evacuation. I fear from the sheer stress and everything of the event. Really interesting. It would be so interesting for someone to kind of now retrospectively go back and ask those folks, what helped you through this? What were barriers? The Red Cross set up a super hot. The Red Cross set up a shelter in West High with cots. It was laughable. These are elderly folks who can't lay on a cot.
Sure.
So it was really interesting. The city's response, certainly management company's response was deplorable, but really interesting how important social networks are in that kind of situation.
Well, thank you very much for the comment. And I see that we're out of time, and I think that's the perfect place to end. Different types of disasters have different kinds of agency. People who are at risk of dying during heat waves are perhaps different from those who are at risk of dying during floods. But what I think your comment really brings to the fore is that it's those social factors and those social networks which are really critical elements of resilience. So thank you very much for the comment.